If you would, tell me your name.
Dorothy Brady.
Okay, Dorothy. Tell me why you came to see me. What was your diagnosis before you came in?
I had lupus, fibromyalgia, IBS, Raynaud's, and depression.
Okay. And had you been to other places before?
I'd been to other doctors,
Okay.
and they just kept giving me pills, which weren't doing
Weren't helping you
no,
much.
and just making other things worse.
Okay. And then, of course, we practice functional medicine here, but we did some lab testing. Well, we talked to you. We got your
Right.
history. We did a thorough history. We did a timeline. We looked at things that might affect you. And then we did a metabolic assessment form, which basically was a series of questions that break down into different body organs, for instance, or systems where your symptoms are. And we decided on a course of action, starting with testing, right?
Right.
Had you ever had any of that testing done before?
No.
Okay. So during that testing, we did a stool and a saliva sample. We found yeast, right? We
Right.
found yeast overgrowth. We found bacterial dysbiosis. We found that your enzymes weren't digesting your food, which is what we talked about a minute ago.
Right.
And through the adrenal stress index, we found that you did have some adrenal fatigue and also gluten sensitivity.
Yes.
And decreased secretory IgA, which is the mucosal lining of the gastrointestinal tract. So once we found that out, we set a course of action which involved diet and lifestyle changes and some pharmaceutical grade supplements. And this is, how far into the program are we, would you say?
Oh, starting.
Close to 3 months?
I was close to 3 months, I think.
Yeah. And then how are you feeling today opposed to the way you were the day you walked in here?
Oh, I'd have to say 85 to 90% better. I'm not nearly as tired. I've got more energy. Aches and pains are going away. The Raynaud's has decreased. Not having so much trouble with my stomach. I'm doing pretty good.
Okay. Now, if someone manages to watch this video that has, because this is not new for you. You didn't just get sick. This has been something you've dealt with for decades.
Decades, yes.
I mean, decades. So within just 3 months, we've been able, with all natural care, to turn your symptoms around to the point that you're saying, well, somewhere 80, 85, 90% better. That's pretty amazing. But if someone is watching this that's frustrated, that's been to many doctors and gotten no relief, would you recommend that they at least look into this type of treatment?
Oh, absolutely, because I have found that other doctors I went to, they never did any testing. They just, well, I think this is it, here's a pill. And we never got to the root of it. And getting to the root of it, finding out what I shouldn't be eating and not eating it, it's made all the world difference.
Yes, definitely. Well, I want to thank you for taking time to share. I know it's kind of, you're vulnerable in a sense, but you know what it's like to struggle.
Oh, yeah.
You know what it's like to fight and to feel frustrated and discouraged because answers seem to be just hard to find.
It is.
But I thank you for being vulnerable and sharing your testimony with folks. Thank you.
You're welcome.
All right.